we'll all make a comment about how, like the diabetes thing, where, I'll say, yeah, doctors tell you that, they can't fix diabetes, but that's a lie. It's easy to fix, takes 3 days, that type of thing. And people call me and they go, my doctor is amazing. They would never lie to me. They're the best human being in the world. Okay. I want to make sure that I clear. I'll do this every time we need to. Your doctor's not lying to you. Your doctor is wrong. The medical community is lying to the doctors and lying to you in general. So you have to understand where the split is. The National Institute of Health, which was Fauci and those guys, mostly led by the drug companies, pharmaceutical companies, they give information to them. They pay for the research the NIH has, and then they all get together and figure out how they're going to create the standard of care. So the NIH, the CDC, and the WHO, and the pharmaceutical companies do the research, and then they select from the research what they want to hand down to everybody else, and then they create what's called the standard of care. The standard of care is basically the rule book, the guidelines that all the doctors then have to go by. And so what ends up happening is the doctors have to stay within those parameters. So for instance, when we talk about COVID, they were told, it's, use the antibiotics, use steroids, and then put them on a ventilator. And everybody was dying, and that was just the standard of care. And if you stepped outside that, you get in trouble. And when I say get in trouble, like these doctors can lose their licenses, they can go to jail, they can get sued, all sorts of things if they step outside the established standard of care, which is again passed down by the National Institute of Health, the CDC, and the WHO, with great influence by the pharmaceutical companies. The pharmaceutical companies fund those entities, and they also fund the vast majority of all research that's done in the United States and around the world. And so when you own the research, you can manipulate it. It's not the most accurate word, but you get how it goes. So for instance, if you get them back and it says that LDL cholesterol, once oxidized, creates heart attacks and strokes, you can say, so it's LDL cholesterol, right? And they go, well, it's after it's oxidized. It's like, well, but we can just tell people it's LDL, that'll work. So that's the type of thing. So what ends up happening is that the guys at the top have all the information, the NIH, the CDC, WHO, the pharmaceutical companies, and then they decide how they're going to create the education that they then hand down to the schools, because that's where a lot of the education is written. And people go, well, what about all the Harvard research and the MIT and the John Hopkins, all the hospital research that's going on in conjunction with pharmaceutical companies, the CDC, the NIH, and the WHO. So the only group that's doing significant research that is outside of that is going to be MAPS. Those are the guys, the multiple disciplinary group who are doing all the psychedelics. Those are the ones coming out and proving that SSRIs were trash. We've always known it, that psychedelics like lysergic acid or LSD, psilocybin, magic mushrooms, ketamine, DMT, which is ayahuasca, are not only phenomenal for you, they help regrow the brain. They help open up old neural pathways. They help release memories. They fix PTSD. They fix addiction. They fix depression. And when I say fix, not like you got to take it every day. Like a lot of the people will do like the ketamine I keep talking about. They'll do ketamine for 4 to 6 weeks, and they're done. That's it. They don't need anything else for their addiction. They don't need anything else for their PTSD. They have from that point forward, you have daily stuff that stacks back on, and you might have to go back and do it again. And what happens a lot of times is, like with myself, is you'll do something, it'll help your PTSD, and then you'll start to recognize that you can not only think clearer, but your goals and dreams and things you need to do to make your life worthwhile and make yourself hit the goals you really deep down inside wanted becomes a lot more clear. You can become laser focused on it. So that's what the MAPS guys are doing. So that research is good. Now, the problem is that when the NIH, the CDC, and the WHO know something, and they choose not to tell the doctors, the CDC, the medical institute, the medical hierarchy, the medical industrial complex, they're lying to everybody, including the doctors. Now, when your doctor takes information from the group they trusted, their school, the CDC, the NIH, when they take that information, and then they learn the information that was given to them, and then they tell you the information that was given to them. They're not lying, they are wrong. Lying implies that you knew the real truth, however you chose to tell somebody different for whatever reason. Good example of this is right now Gary Brecka and Perfect Amino have an advertising campaign going that says whey protein breaks down into sugars, which is a lie, and Gary Brecka knows that. That's why it's a lie. Some of the people who are pushing this along, probably they're wrong. Gary 100% knows it's a lie, and he's pushing it anyway just to make some money. On that, real quick, all proteins break down into amino acids. They do not break down into sugars. That's 100% a lie. Once they're amino acids, your body can absorb them and put them through a process called gluconeogenesis, where your body takes those amino acids and makes sugar out of them. That is 100% supposed to happen. You want it to happen. It's hypercritical to life that happens. So if after a workout, you take whey protein or you take the aminos he's selling, and he knows this, and you consume those, your body will have low blood sugar because you just exercised. And while your muscles can run on fat, your blood cannot. Your blood has to run on sugars. And so your body makes sugar for your blood, so your blood can run on that sugar, and that's how that happens. Now, it doesn't make enough sugar to create an insulin response that would then cause a storage function that would then cause you to get fat. So the idea that whey protein is going to make you fat because it's going to turn into sugars is 100% a lie. And again, Gary knows this. So this is kind of the issue that we get into. When you know something is wrong and you tell everybody anyway, that's a lie. That is not where most of your doctors are at. The vast majority of doctors don't know how to fix diabetes. They don't know that cholesterol by itself is completely fine and one of the best things for your heart. They don't know that testosterone is hypercritical to life. They don't know that psilocybin and ketamine can do the things it can do. They don't know because they have not been told. In fact, they've been told something totally different. So this is where we're getting into. It's not that your doctor's lying. I'm sure your doctor, if they knew these things, would change the way they practice. This is why functional medicine is becoming a thing. The chiropractic and the natural community for years has been screaming about this stuff and how vaccines have problems, have all these things. And finally, some of the doctors were like, well, I'm going to disprove you because you're wrong. I'm tired of hearing about it. And so they went and they did the research and they're like, oh, crap, you're actually right. We should change what we're doing. And that's how the birth of functional medicine actually happened. So all these functional medicine doctors you're seeing, all these physiology-based doctors that you're starting to see have been basically looking at the natural community, mocking us, and then they finally decided to prove us wrong. And in the proving us wrong, they proved us right. That's how the functional medicine group was born. And so that's what's actually happening. So a lot of these pediatricians who actually read the research and started looking at what's going on and started asking for all the research. You know, all the pediatricians were like, oh, vaccines are 100% safe. There's tons of research proving that. That's depending on who tells you that, that's a lie or that's wrong. I would tell you that any doctor who tells you that is actually lying to you because they could look up that information and they chose not to. So yeah, according to, I've looked for it. I can't find any double-blind clinical studies with longitudinal axis that prove that childhood vaccines are safe at all or effective at all. I can't find the research. And according to RFK, Robert Kennedy, he sued the National Institute of Health for them to give him the research, and they came out and they said, we don't have that research. We've never done it. And so that was a big thing. And he said that enough that if that was a lie, he would have been sued out of existence at this point. And so, you know, I can't find it. He says it doesn't exist. He hasn't been sued. So I'm going to go with it doesn't exist. So if the pediatricians will tell you that they've read the research, that's a lie because there isn't research out there. But that type of a thing. So as these people started to do the research, they started trying to disprove everything that the natural community has said. They've started to realize we were right, they're wrong, and that's where functional medicine is coming from. So that's the shift you're starting to see. So my goal is that when I tell people, you know, cholesterol's not the thing to worry about, you need to eat a calcium CT, it's not because I'm trying to start an argument. It's because a lot of people are dying because their doctors tell them that they have good cholesterol levels, and so they don't need to worry about heart attacks and strokes, and then they have a heart attack and they die. That's what the UCLA research shows. That's what a lot of the other research is showing, is that these people who are getting heart attacks and strokes have good or normal cholesterol levels, but they're still having arterial plaquing and they're still dying. And so my argument was that quit listening to the labs, go get the test that shows plaquing, go get the test that shows how your heart's working. do those. Don't do the test that only leads to the statin drugs. Not that, cholesterol, not that high cholesterol is good or bad, or low cholesterol is good or bad. It's just that we're using the wrong test because we've been lied to that all we need to worry about is cholesterol, because that path only leads to statin drugs. That's why the head guys, the NIH and those guys, tell you that the only thing we need to worry about is cholesterol levels, because they're trying to sell statin drugs. That's where it is. So, and then they told the cardiologist and everybody else are like, okay, we'll pass along that message. And that's where the issue is. So again, the doctors are not necessarily lying. Some of them might be, but blanket statement, the doctors are not lying. They're being lied to by the same people who are putting out information that we're supposed to eat. Just like the NIH and the CDC and the government put out that Frosted Flakes and Cheerios and Lucky Charms are healthier for you than steak and eggs. This is where we're at. So we all have to kind of decide who we're going to listen to now. Are we going to listen to the CDC, the W.H.O, the NIH, or are we going to listen to people who have the chemistry and people who have the information and that type of thing? So that's kind of the fight that we're in. So if you guys are recognizing that fight, share the stuff I'm talking about, share the stuff with people. Let's get the information out there, because a lot of the stuff, like the echocardiogram, the calcium CT stuff, literally will save people's lives. So when you guys see the social media we're putting out that talks about that, share it with everybody. Share this video with people. Share the videos we're putting out with people. It's funny because I talk about testosterone all the time, and I've had several people call me and they're like, who would you go to get testosterone? I'm like, I have a hormone therapy company. And they go, oh, you never mentioned that. I didn't know. Right. So I'm not trying to sell everybody stuff. I'm trying to get the information out so that you guys can make better decisions on your health. So I'm trying to give you the options so you can make your own decisions. That's the whole point of what we're doing. So share this information with people, get this stuff out, because apparently they're not going to be getting it from their doctors because their doctors are getting lied to, not because the doctors are bad people. Most of these doctors are phenomenal human beings who've dedicated their entire life to helping people, and they're trying their hardest. They just got bad information because they were lied to by people they trusted. So then they pass that information along. So that's kind of how that goes. So I wanted to clear that up, make sure everybody knows that I'm not calling your doctor per se a liar. And I realize that your doctor can't do all the labs and tests that I do, because they're under a different standard of care than I am, because they're based on insurance and that model, and I'm based on cash, which is one of the reasons we went cash. So we can do things that other people can't. However, still at the same time, we need to get the information out so people can start making the better decisions about their own health. So share this stuff. If you guys have any questions at chalmerswellness.com, or always drop them in the comments and we'll get you guys answered. Thanks for your time.